HPV. This virus has remained one of the most common infections year after year. It often causes growths that look like cauliflower, commonly known as genital warts. They are also nicknamed cauliflower lumps. This once overlooked infection is now widely recognized as HPV. Around 85% of sexually active people will come into contact with the virus at some point in their lives. It spreads widely throughout communities. Its full name is a human papillomavirus. With a bit of luck, you may avoid the more serious consequences. Filamentous warts. Flat warts are also skin lesions, similar to moist warts. Those small flesh-colored bumps you may have noticed on the skin are most likely warts caused by HPV. If you're unlucky, it could eventually lead to cervical cancer, vaginal cancer, anal cancer, or malignant tumors such as oropharyngeal cancer. Even Oscar-winning actor Michael Douglas once revealed that his throat cancer was caused by an HPV infection. According to global health statistics, more than 300 million people are infected with HPV worldwide. Over 99% of cervical cancer cases are linked to HPV infection. Around 90% of anal cancers are also closely associated with HPV. This makes us wonder, why is HPV so strongly connected to cancer? How exactly does this virus lead to different kinds of cancer? What are the links between the different cancers it causes? And most importantly, how can we prevent it? We'll also look at treatment and how to tell the differences between types of HPV. That's the focus of this episode. Let's uncover the truth about HPV together. I hope this will leave a lasting impression on everyone. The first thing to understand is this. HPV is not just a single virus. It's an entire family of viruses. Scientists have already identified more than 200 types of HPV. Some types of HPV are relatively harmless, but the more dangerous strains cause genital warts, as well as common warts, flat warts, and other abnormal skin growths. This is known as low-risk and high-risk HPV. High-risk HPV can cause cervical cancer, anal cancer, and other malignant tumors. This group includes HPV types 16, 18, 31, 33, and many others. About 70% of cervical cancer cases are caused by type 16 and 18. With such a large family of viruses, it's no wonder that sexually active people are especially vulnerable to HPV. But remember, being infected with HPV is not the same as having cancer. HPV infection can be completely equated with a type of disease. Let's explain why. As we all know, the skin is the largest organ of the human body. It serves as a barrier that protects us from countless pathogens. HPV invades by targeting skin cells, using them to replicate. So while our skin's defenses are strong, to HPV it's just a barrier waiting for a weak spot. Of course, that doesn't mean HPV can take root the moment it touches your skin. It needs an opportunity like a tiny cut in the skin, a tear in the mucous membranes, or skin that has become moist and soft. That's when the virus can reach its target, the basal layer. Why the basal layer? Our skin has two main parts, the epidermis and the dermis. The basal layer cells lie at the bottom of the epidermis. At the bottom of the epidermis, cells are capable of continuously dividing and moving outward, creating a steady stream that replenishes the different layers of cells in the epidermis. This process is exactly what HPV takes advantage of. By targeting these basal cells, the virus can replicate itself. Once HPV reaches the basal layer, it releases specific viral genes to take control of the host cells, turning basal cells into emotionless breeding machines, forcing them into uncontrolled replication and producing massive numbers of infected cells. These infected cells gradually build up as they move toward the skin's surface, eventually forming the warts that we can see with the naked eye. Different subtypes of HPV can infect different parts of the body. This leads to different kinds of warts. Common warts are often called verruca vulgaris. They often appear on the back of the hands, starting as tiny, pinpoint-sized bumps on the arms, and gradually growing to the size of a soybean. Their surface is rough, and their texture feels hard. When warts appear on the feet, they are called plantar warts. Some patients may experience severe pain from them. These are mostly caused by HPV type 1, as well as types 2 and 4. Filiform warts often appear on the eyelids, around the neck, or along the jawline. They appear as single, soft, thread-like bumps. The top is often hardened, looking like a tiny, upside-down spike. Sometimes the wart grows larger, resembling a budding flower, or a lotus flower when it spreads open. Flat warts are mainly caused by certain types of HPV. especially types 3 and 10. On the face, the backs of the hands, and the forearms, flat warts often appear as bumps the size of sesame seeds, or raised spots about the size of a mung bean. Their surface is usually smoother than common warts. Once these warts are scratched, or when the infected skin cells die, they release a large amount of virus, which can then infect other parts of the body, or even spread to other people. Here's the good news. Up to this point, things are still manageable. But the bad news is, some types of HPV prefer to infect mucosal epithelial cells, including those in the mouth, the reproductive organs, the anal area, and the cervix. And this type? That's the genital wart, which many people are more familiar with. These growths usually appear about 3 months after infection. They vary widely in size, appearing as cauliflower-shaped, papillary, or cockscomb-like growths. Sometimes they cause itching or a burning sensation. Pain and bleeding may also occur during outbreaks, especially if the warts collapse or erode. Here's the good news. 90% of these cases are linked to HPV types 6 and 11, and those are considered low-risk types. Most likely, it is the high-risk strains we need to worry about. The bad news is, if it's a high-risk type of HPV, when epithelial cells are infected with type 16 or 18, it may take 10 to 20 years, but the virus can eventually break through the basement membrane of the epithelium, invading deeper tissues and transforming into cervical cancer, vaginal cancer, or other malignant tumors such as oral cancer. Is there any way to prevent this? The key to preventing HPV is to cut off its routes of transmission. The most common route, as we all know, is sexual transmission. During sexual activity, if there is a wound on the surface of the mucosa, or if the activity is more intense and causes damage to the skin, it makes it easier for HPV to take advantage and infect. If one partner is carrying HPV, the risk of passing it on during unprotected sex can reach 40% to 60%. That's why wearing protection is so important. In other words, use a condom. At the same time, avoid risky behaviors. Don't experiment in unsafe ways, because that only increases the chance of infection. Also, avoid frequently changing sexual partners or engaging with sex workers, because repeated exposure greatly increases the overall risk. And many people with HPV are in the incubation period or show no symptoms at all, so you can't tell just by looking at them. Secondly, get vaccinated. You've probably already heard about this. HPV vaccines are available worldwide. Only 11 of them can effectively prevent cervical cancer. During peak times, it can be almost impossible to find. And here are 3 brief points to remember. First, the bivalent vaccine, along with the quadrivalent and the 9-valent vaccines, can all protect against HPV. The higher the number, the more HPV subtypes it can prevent. But all of them protect against type 16, which is strongly linked to cervical cancer, and also type 18. Secondly, men can also benefit from vaccination. The HPV vaccine is not only for preventing cervical cancer. It should not be seen as something only for women. At its core, it is meant to prevent infection from certain types of HPV. For boys, after vaccination, it can help prevent infection to some extent. It can lower the risk of genital warts caused by HPV and reduce the risk of vaginal cancer, as well as other related cancers. It also helps protect their partners. In real life, men, poor hygiene or repeated infections can increase the chance of illness and relapse. Third, according to current medical guidelines, the recommended age for girls to be vaccinated is between 9 and 14 years old. It is best to get vaccinated before the first sexual activity, but the vaccine is still protective between the ages of 9 and 45. And finally, it's also important to note the possibility of indirect HPV transmission. For example, if someone at home is infected with HPV, avoid sharing personal belongings, especially underwear, which should always be washed separately. So here's another example. Some small private clinics advertise on telephone poles, but their gynecological equipment may be contaminated. So for gynecological or andrological issues, it is recommended to visit a proper hospital for treatment. So if an HPV infection keeps coming back, is there any way to deal with it? Currently, a perfect drug to cure HPV can be described into words. It doesn't exist. So why do we still see miracle HPV cures advertised online? What about the legend of the so-called magic medicine? The key is that after some people use it for a while, they really do seem to heal. The reason is simple. The vast majority of people recover on their own. About 90% of HPV infections are cleared by the immune system. Even genital warts, which everyone dreads, can often be eliminated by the immune system. The immune system clears most HPV infections. The infection becomes subclinical, meaning it no longer causes symptoms, or symptoms disappear quickly after a short time. About 60% of infected people clear the virus within 6 months. But don't think that after infection you can just wait until it heals itself, because about 10% of people will still experience recurrence. This means persistent infection. Some people will develop visible warts. At this stage, it is recommended to go to the hospital to remove the warts as soon as possible, because warts carry infectious virus particles. The more they spread, the harder they are to treat. Depending on the number and size, doctors may use targeted removal methods. These include medication, laser therapy, cryotherapy freezing, or surgery. Another group of infected people show no visible signs on the surface, but that doesn't mean everything is fine. Because if you are infected with high-risk HPV and the infection persists or keeps coming back, it may eventually cause cancer. More than 99% of cervical cancers are closely linked to HPV infection. In 2023 alone, there were 13,960 new cases of cervical cancer in our country, nearly 4,000 deaths. So if a woman has unusual discharge, pain with a foul odor, abnormal bleeding, or persistent pain, she should seek medical attention as soon as possible. At the same time, it is recommended that women aged to 1 to 9 get a cervical cancer screening every 3 years, mainly through a pap smear test (TCT). This checks your cervix to see if there are any abnormal cells. Women between the ages of 30 and 65 should also have a pap smear every 3 years, or once every 5 years. They can do an HPV test, because the earlier it is detected, the better the chances of preventing cervical cancer. Finally, whether it's treatment or prevention, all require the participation of our immune system. So we need to take good care of it. Get enough sleep, exercise regularly, eat a healthy diet, and maintain a positive mood. By sticking to these 4 habits, we help our immune system recharge. As the saying goes, you build your health over thousands of days, but you rely on it at critical moments. At such critical moments, our immune system won't let us down. So that's it for this episode. If you found this helpful, or if it helped you even a little, please consider following us. That way you can learn more medical knowledge.